Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. Behind me is Guggenheimer Health and Rehabilitation Center, a division of Centra Health. This week is Rehabilitation Awareness Week. My guest tonight is Dr. James Dunstan. Dr. Dunstan is Director of Rehab Services for Centra Health, an orthopedic surgeon and wound care specialist. He wears many hats. Dr. Dunstan, I'm really delighted to have you as my guest on Lynchburg Live.
Good to be here, Linda.
As we begin, would you please tell our audience what your job as Director of Rehab Services entails?
Well, I'm actually Medical Director of Rehab Services, and that implies a little bit more clinical than administrative involvement. I'm paired with a Senior VP, David Adams at Centra, who kind of works on the business side a little bit more than I do. My main roles are working with our physician group, kind of leading them. I have the shortest and grayest hair, so that's probably why I lead them, and that's why I need my hat, many hats. So I do that. I work with our therapy groups in many settings to inform them of medical conditions, medical advice I can give them. I work with program development, building new programs. And then I'm very involved clinically in different areas of rehabilitation that Centra does. We have a large continuum of rehabilitation care. We do inpatient rehabilitation, we do outpatient, we do home health, and a lot of specific programs therein. We also do skilled rehab, as we've talked about before.
How many facilities are you medical director of?
Well, it's hard to say. We have the Virginia Baptist Hospital where we have our acute rehab unit, where I was medical director when I first started with Centra. We have our Center for Rehabilitation, which is intensive care. It's a long-term acute care unit. We have Lynchburg General. We do acute care rehabilitation, as you know. We do the skilled facilities, which are Guggenheimer, Summit, and Fairmont. We have 4 outpatient clinics where we specialize in neuromuscular care, wound care, cancer care. We actually go to Danville and have a clinic down there, and we do home health. So a lot of different areas.
There are a lot of different areas. Has your background as an orthopedic surgeon given you a better understanding of rehab services and what your patients need? I'm sure it has.
Yes, it has. And, you know, even my own orthopedic injuries have told me what that all means. But 2 things happened in my career. I was a hand surgeon, as you know, and we would replace knuckles with silastic, which were just plastic. But it was basically the therapy that helped the hand move and keep the joint stable by creating a joint capsule around that prosthesis. The other epiphany moment I had was when I actually started doing rehab and worked with occupational therapists helping people do activities of daily living. So I would maybe do a total knee replacement, and then when I saw the patients in rehabilitation, I realized they couldn't sit and get on the toilet, they couldn't move around their own house, they couldn't climb the stairs where the only bedroom was. And so it gave me a greater appreciation of all that rehab can do to improve people's lives.
You know, it really does. Having had a total knee myself, I know that your surgery, you know, you have to have good surgery.
Right.
But your rehab is equally as important to getting you back to doing your life as you knew it before the surgery. And, you know, so I know how important rehab is. With any rehab services, the main goal for the patient is what?
Is to recover as much function as is possible. I have this saying, and it doesn't make much sense to people, but I like it. It's rehab is where you go it's where you go to get better after getting well. So basically in acute care, you have your surgery, you get your recovery in intensive care unit from being very ill, and you're recovered, but usually you're down on calories, energy, mobility, ability to do transfers. And so rehab is where we get you better and try to achieve as much as we can for the patient to get them back to the lifestyle they want.
Now, you've mentioned joint replacement, which, rehab is key for joint replacement recovery. But what other medical and surgical conditions really need rehab?
As I started on the acute rehab unit, one of the patient types we most often took care of were stroke patients.
Right.
And they, to see the impairments that they had to live with, really reinforced what our therapists could do. We have speech therapists working with swallowing issues that I had not considered before. We had upper extremity folks, our occupational therapists, working on activities of daily living and upper extremity concerns, whether it was spasticity or contracture, and our physical therapists helping strengthening the patient and helping them ambulate again. That's a major group of patients. Wound patients can be. They get contractures. They get too much weight bearing on certain areas of their body and their skin can break down, especially in diabetic patients or patients that can't feel an area. Work, getting people back to work is very important because the demands of work, certain jobs, can be significant, and building someone up after an injury and giving them the proper motivation to get back to work is critical.
Now, the patient's physician or surgeon writes an order for rehab while the patient's still in the hospital and also writes that order for rehab on an outpatient basis. Is that true? That's
true. The treating physician really triggers the downstream rehabilitation, and that's where we get involved, and we report back to the primary doctor, whether it's an orthopedic surgeon or whether it's a family practitioner. The key is we work in consultation. We don't take over care of patients. We provide our input. For example, someone had an amputation. Physiatrists or physical medicine doctors are very good at helping make sure the prosthesis fits correctly, it's the right length. We can improve the patient's gait, that type of thing. So we consult in the areas where rehabilitation intersects with that patient's life.
Something that you had talked to me about that I find fascinating is your work you're doing with Botox, injections for spasticity. Can you tell us a little bit about that?
Right.